Welcome, everyone, and thank you for joining us today. My name is John Riley, and for the next 15 minutes or so, we're going to simplify Medicare and help you understand the decisions you'll need to make as you approach age 65. So if Medicare feels confusing, you're not alone. Most people say that they feel overwhelmed when they first start researching Medicare. But the good news is by the end of today's webinar, you'll understand the key decisions and know what steps you need to take next. So we're going to focus on the information that matters most. We'll discuss the two major Medicare paths available to most people. We'll cover Part A and Part B of Medicare, your prescription drug coverage, and what happens if you're still working past age 65. I know that's important for a lot of people as we work even into our 70s, and the mistakes that we see people make most often. So my goal today is not to turn you into a Medicare expert. However, my goal is to help you make an informed decision. So before we begin, let's talk about why Medicare planning matters. So most people don't intentionally make Medicare mistakes. They make them because the rules are complicated. Missing a deadline can create penalties, and choosing coverage without understanding your options can leave you frustrated. And overlooking prescription drug coverage can result in unexpected costs, which you don't want that, right? So today's webinar is designed to help you avoid those type of problems. Okay. So when people first call our office, they usually have one big question, right? It's like, okay, which Medicare option is right for me? Well, that's what we're going to handle in today's webinar. So as we move through this presentation, I want you to kind of put yourself in the situation as we go through different scenarios and just see kind of where you feel like where you're going to land. Okay. All right, so most beneficiaries ultimately choose one of two paths. Path number one is original Medicare combined with a supplemental plan, also known as a Medigap, and that covers the gaps in Medicare, original Medicare, and you're going to pick up a Part D prescription drug plan. So that's going to be original Medicare plus a supplemental and Part D. Path two is a Medicare Advantage plan, and that covers everything in the first path, and it's handled all under one carrier, kind of like an HMO model, and that's the way that works. So neither option is universally better. The right choice depends on your priorities, on your healthcare needs, your doctors, whether you travel a lot, and your budget. Okay, so we're going to take a look at some scenarios here. So let's look at a real world example. Susan is turning 65. She enjoys traveling. She visits family in multiple states, and she wants flexibility and doesn't want to worry about provider networks and rules. So as I described Susan, just think about whether any of these priorities sound familiar. Could this be you? Okay. So for Susan, flexibility was extremely important. She wanted the ability to see providers throughout the country who take Medicare, who accept Medicare. She wanted predictable healthcare expenses, and because she travels frequently, nationwide access was very important to her. If these things are important to you, like Susan, original Medicare combined with a supplemental plan might be your best option. Okay, let's take a look at scenario number two. Meet Robert. So Robert doesn't travel often. He's very comfortable receiving care through a network, through a local network, and his primary concern is keeping monthly costs as low as possible. So does Robert's situation sound more like yours? For Robert, lower monthly premiums were important. He liked having his medical and prescription drug coverage packaged all together into one product, and he was comfortable working with a provider network. So for people with priorities similar to Robert's, Medicare Advantage plans, that HMO model, may be a good fit. Okay. So regardless of the path that you eventually choose, Medicare begins with Parts A and Part B, known as Original Medicare. And that's the foundation of Medicare. Everyone signs up for Original Medicare. So now let's quickly review what each one covers. So Part A is often referred to as hospital insurance, and it covers inpatient hospital stays, skilled nursing, hospice, and even some, healthcare services at home. Most people qualify for premium-free Part A based on their work history. For Part B is known as your medical insurance. This covers things like doctor visits, labs, x-rays, diagnostics, and other medically necessary services. So most people pay a monthly premium for Part B, and it starts out at $202.90 for 2026. And it's based on income. So the more money you make, there's a graph, and it will show you what your premium is. But most people are going to start at $202.90. Okay, this slide surprises many people, but it shouldn't. Medicare doesn't cover everything, right? Most dental and vision services aren't covered. Hearing aids aren't covered. Prescription drugs are not covered with copays. You do have a little bit of coverage for some of your bigger injectables through Part B, but you don't have a separate drug plan included with Original Medicare. And also deductibles and co-insurance, you have those out-of-pocket costs. So that's why many people add additional coverage, like we've talked about, either a supplemental and Part D to Original Medicare, or they go with an Advantage that covers all of those items. So Medigap policies, let's take a look at that for a second. Medigap policies, also known as supplemental plans, they're designed to fill in the gaps left over by Original Medicare. So think of Medicare as providing the foundation, and your Medigap plan helps reduce much of those out-of-pocket expenses that Medicare does not pay for. So if you're going to stay with Original Medicare, you should strongly consider adding a supplemental plan to fill in those gaps, give you an out-of-pocket maximum, and cover some of the co-insurance. Okay. If you want the freedom to see virtually any provider who accepts Medicare, then a supplemental is going to be the way to go. You don't have to deal with referrals or networks. If you travel a lot, you prefer predictable healthcare expenses, then a supplemental plan is a good way to go. If those priorities are important to you, then exploring the supplemental Medigap option is going to be your best option. Okay. Like every option, though, Medigap has advantages and disadvantages. The advantages are flexibility and predictability of costs. The trade-off is you have a higher monthly premium and you need to purchase a separate prescription drug plan. Okay? The goal is finding the balance that works best for your situation. So now let's talk about prescription drugs. This is one of the most important topics in Medicare planning, and is also one of those areas where mistakes can be expensive, and we see it happen. Let's take a look at Barbara. Barbara takes several common medications. She takes blood pressure, cholesterol medication, medication for diabetes. So here's an important question. Do all prescription drug plans cover these medications the same way? The answer is no. Different plans have different formularies. Different pharmacies may have different costs, and different plans place these medications in different tiers. So you're going to have a different copay or co-insurance for them. That's why we always recommend reviewing your specific medications before choosing a plan. And keep in mind, even if you don't take medications, if you're going on to Medicare, you're going to have to get a Part D plan. Okay, otherwise you're going to get a penalty. So before selecting a prescription drug plan, make sure you review your medication list, review your preferred pharmacy, estimated annual costs, and confirm how each medication is covered. Taking these steps can potentially save you hundreds, if not thousands of dollars. We can simply help you with that if you would like. Okay, you can just reach out to us. So one of the most common questions we receive from people is, from people that are still employed is, do I need Medicare if I'm still working? Right? So the answer depends on your situation. If you're still working, you may or may not need to enroll in Medicare. Tom is turning 65. He's still working. He has employer coverage and he's not collecting Social Security income. So should Tom automatically enroll in Medicare? Well, the answer depends on factors such as employer size and the type of coverage available. This is one of those areas where personalized guidance can be especially valuable. Having that one-on-one discovery call with us where we can get to the details that are specific to you is important. So making assumptions can create penalties later. You can give us a call and schedule a time if you'd like, and there's never a cost for our services. So you don't need to memorize every Medicare enrollment rule. However, there's 3 Medicare enrollment periods that you should be aware of. Your initial enrollment period when you're first turning 65, the special enrollment period when you maybe come off your employer plan later, and the annual election period. That's your annual checkup where you can review where you're at, medications changed, that sort of thing, and then make a choice for the new year. Okay, so understanding these timelines can help you avoid unnecessary penalties. So let's finish by reviewing the 5 mistakes we see most often. If you remember nothing else from today's webinar, remember these. Okay, so we're going to count down. So number 5, many people underestimate the importance of prescription drug planning. Okay, so reviewing your medications before enrolling can prevent costly surprises. You don't want to get into the new year and realize the medication is not covered. It could be expensive. So even if you don't take medications, like I mentioned, you may still need to purchase a plan so you don't pay a penalty. So another reason to reach out to us and we can have a quick chat. All right. The lowest premium, this is number 4, isn't always the lowest overall cost. Big surprise, right? So provider access, prescription coverage, and out-of-pocket costs and exposures are all matter. So it's not just one thing, it's many. Okay. Number 3, people assume Medicare covers everything. Well, that's not true based on our call today. So we discussed, so understanding those different gaps is critical. Right. And number 2, enrollment deadlines matter. Missing them can create penalties or reduce your future options or even give you a gap in coverage. And then the last one, the biggest one that most people make is making a Medicare decision before they really understand their options. So the more informed you are, the more confident you'll feel and the better decision you'll make. Right. So here's the action plan for you. Understand your timeline, review your prescriptions, think about your providers, determine which Medicare plan best fits your needs, and ask good questions before enrolling. If you want to work with us, this is our process at Riley & Associates. We have a 3-step process. Basically, we have your discovery call where we get to understand kind of what your needs, where you're at, what you might need going in the future. The second meeting, we prepare a presentation for you. And that way we can go through just a one-on-one with you, the basics of Medicare. It's a personalized call just with you and I. And we go through your different Medicare options that are available to you as well based on the discovery call. And then if you're ready, we make a decision and get you enrolled. And then the third is what we call the orientation meeting. That's usually a few weeks after you've enrolled, you've gotten your welcome kit and your card. We go over the plan with you, make sure you understand how to access your benefits. We answer all your questions, and then we kind of go over some of the things that Medicare does not cover so you don't have any surprises. And then, of course, we take care of you all year long. So we're here for you. Hopefully you're a client for life, and that's our goal. So thank you for spending time with us today. We hope this webinar has helped you better understand Medicare. And if you'd like a personalized guidance, there's never a cost for our services, and we're happy to help you. We're here for you. So have a wonderful day. Thank you again for joining us, and we look forward to speaking with you soon. Thank you.